Hey, welcome. It's Ashley from Demystifying Your Health. Today we're going to be talking about acne. We've all been there. You wake up, it's the morning of your big presentation, and there it is, on your face. A giant red pimple on your nose. What are you going to do? Is there anything you can do in that moment? And how do you prevent acne in the future? Acne is a condition that affects your skin. It's most often found on your face, forehead, chest, upper back, and shoulders, because this is where your body has the most sebaceous or oil glands, which is also connected to the hair follicles. It's important to note that these are different than your sweat glands. There are 4 main factors that can cause acne to occur. The first is having excessive oil production. The next is having hair follicles being blocked with oil or dead skin cells. Also, the presence of bacteria, and increased androgens, which are hormones that are elevated during puberty. There are some other factors that can also elevate your chances of having acne. This can include certain medications like oral contraceptives or corticosteroids, taking in certain foods such as chocolate, skim milk, or carbohydrate-rich foods like bread and bagels, stress, or wearing lotion or tight clothing. This is why it's easy to see, even though acne is more present in teenagers, but anyone can actually have it. Acne presents with a wide variety of symptoms, which also indicate the severity of it. The first type is whiteheads, which is when the pore is closed and bulges slightly. Blackheads is when the pore is clogged but open to the air. Often this might look like dirt on your face or something along those lines. A papule is when the area becomes inflamed, so it looks like a small, tender red bump. A pimple is a papule with pus at the center, which is where it's red with the little white dot in the middle. Nodules are large, painful, solid lumps that are deeper in the skin, and cystic lesions are painful, pus-filled lumps that are deeper in the skin. When it comes to treating acne, there are several things to do. The first step is trying some techniques that you can do at home. The first is to wash the problem area twice daily, gently, with soap and water. If you get acne around your hairline, definitely wash your hair at least once a day. If you need to shave the area, do so carefully. Avoid any products that can make your acne worse, such as lotions or anything that's oil-based. Use water-based cosmetics and non-oily, moisturizing sunscreen. Avoid tight clothing. Using over-the-counter products that promote drying, such as salicylic acid or benzoyl peroxide, are very helpful. Just remember, it can take a couple of weeks for these to actually start showing results, so don't get discouraged if you don't notice anything in the first couple of days of using them. And then the last and most important is to not scratch at your acne, because this can actually cause scar tissue to develop in that area. If for some reason the at-home treatments don't work as far as getting rid of your acne, you'll most likely need to see a dermatologist, and they will offer a couple of different options. Usually they start with some form of medication that's prescription strength, so it's stronger than what you can get over the counter. There are 2 main types, topicals or orals. With topicals, you actually apply it to your face, versus orals, you actually ingest a form of pill. With topicals, you have retinoids or retinoid-like products, you have antibiotics, prescription-strength salicylic acid, or dapsone. With orals, you have pills, form of antibiotics, anti-androgens, or oral contraceptives for women, or isotretinoin. This is very powerful, so this is often used as a very last resort if for some reason none of the others are working. With either one, it's important to remember that it can take 4 to 8 weeks to see any improvements, and it can take months or years for your acne to go away completely. It's important to keep in mind that most likely your acne is going to get worse before it gets better. Some other options, if for some reason these medications are not helping, or your doctor might suggest something else, would include laser or photodynamic therapies, chemical peels, extraction of whiteheads or blackheads, or steroid injections. It really depends on the severity of your acne as far as what your dermatologist will most likely recommend. but they will definitely help guide you in this area. When it comes to preventing acne, it's very similar to the at-home remedies as far as treating it. Some of the main points that you should focus on are washing the area gently on a regular basis. Avoid products that irritate or dry out your skin. Avoid oil-based products, particularly sunscreens or lotions. Avoid any tight clothing or anything else that would cause friction or rubbing on your skin, which would most likely lead to breaks in it, which result in the clogged pores. There's no question that having acne can be embarrassing and annoying, but it can be managed. With just a few simple changes, you'll be on your way to having clear skin. Stay healthy!